Today I want to talk to you about advantages and disadvantages of augmentation mastopexy procedure, which is all-in-one breast lift and augmentation procedure. The main advantage of this operation really is the fact that everything's done in one operation, under one anesthetic, under one set of recovery, and which is very appealing to a lot of patients because obviously you have to have less downtime and you get to your goal quicker. The main downside of this operation is also related to the fact that it's all done in one operation. What does that mean? It means that you have compromised on a number of issues to address the overall set of problems that a patient has to be able to do a lift and an augmentation all in the same time. So typically you can't do a lift quite as much as you would have liked to have done. So the nipple positions tend to be a compromise, which means that you are likely to get an earlier recurrence in terms of your droopiness of the breast or the breast that's starting to point south itself. You may also may need to compromise on the volume of the implant as well to try to be able to give some kind of lift to the patients. So you can see that here that you not really getting the best out of the breast lift procedure or the best out of the breast augmentation procedure. However, if that's your preference and that's what you want, then that can work really, really well. One of the other things to think about is you have different forces acting with the breast lift and the breast augmentation. The breast lift is trying to tighten everything. The augmentation is trying to spread everything out, push everything out. That impacts on things like scarring and healing. Healing can take longer because of this countering forces. The scars can also stretch. The areolas can be, instead of smaller during the lift, become wider as well, again, because of the augmentation that's associated with it. There's also some possibility of loss of sensation of areola or nipple during this procedure, which is also present with the breast lift itself, but it's more so with the augmentation. So it's something to definitely consider, and as I said before, it's not an operation that I'm very fond of for those reasons. I do think you can get a better result if you separate these procedures. And one other thing to think about, in about up to 20% of procedures that have this done all in one, you end up needing a revision touch-up surgery anyway. So you kind of end up having a second stage anyway, in probably up to 10 to 20% of cases, according to literature. So in many cases, you will end up having two procedures, albeit a second small operation. And if that's going to happen in a substantial number of surgeries, my philosophy is that why don't we just plan for that anyway from the very beginning and actually make that part of what we do and get the best out of that.